human body is vulnerable. We can all fall ill. Finding solutions to the many potential diseases is our key mission. It was also Dr. Paul Janssen's motivation when he began his research over half a century ago. Dr. Paul was one of the greatest discoverers of new medicines. A brilliant scientist, he was above all a doctor determined to cure patients. With his research teams, he broke new ground in the fields of schizophrenia, anesthesia, pain relief, gastrointestinal diseases, and fungal infections. The Janssen medicines have become vital to millions of patients all over the world. For many diseases, there's still no effective treatment. Treating patients by discovering and developing innovative medicines is the major purpose of our company. All companies of the Johnson & Johnson Group share the same ethical values. The patient comes first. As stated in our vision, by 2020, the world of healthcare will be characterized by informed and empowered patients who want access to the best available treatment at an affordable price. New therapeutic solutions for unmet medical needs will be developed through partnerships with industry, academia, government, healthcare professionals, and patients. In this environment, Janssen will lead fundamental change in the way diseases are managed. In our total commitment to patients, we will build innovative, integrated healthcare solutions that will restore and extend the quality of life, while creating economic value for society and our company. We will achieve this by working side by side with healthcare stakeholders and by building on our people's talent. It's our mission to focus our energy on 5 major therapeutic areas of unmet need: neuroscience, infectious diseases, oncology, immunology, and metabolism. We will develop sustainable, integrated healthcare solutions by working with patients, physicians, and other stakeholders based on partnerships of trust and transparency. We will continue to invest in our people to realize their personal growth and to build our leaders of the future. We will also use our Credo as our moral compass. We are committed to our social responsibility. We invest in diversity programs, offer help to social organizations, and make medicines accessible to developing countries. We also stimulate the use of green energy and the best environmental technology. Spearhead technologies accelerate the search for those molecules that really matter. The research process is a long elimination race. The effects of tens of thousands of molecules on one disease are studied, producing hundreds of promising potential medicines. These are tested in laboratories using animal models. We investigate the way these compounds interact with the body. Many molecules are discarded. Only the best are tested on humans. We evaluate possible side effects and efficacy and determine the optimal dosage. In every phase of the development, we comply with strict legal requirements and are regularly inspected by the authorities. Developing a medicine takes 12 to 15 years. On average, only 1 out of 10,000 tested molecules makes it. But it's all worth it, because we have discovered and developed a new medicine. The value of new medicines to the patient and to society in general is enormous. In 1980, an infection by the HIV/AIDS virus was still fatal. Nowadays, patients who are treated in a timely manner can be helped to survive and lead a relatively normal life. Thanks to appropriate treatment, 70% of the epilepsy patients are still seizure-free after 5 years. Most schizophrenia patients had to be confined. Today, medicines offer an acceptable quality of life to most patients. If cancer is treated on time, the average survival rate is now about 50% after 5 years. For certain types of cancer, the survival rate is even as high as 90%. Despite all of these important medical breakthroughs, 3/4 of the 30,000 diseases known today are still untreatable. Everyone in our company, based on his or her own speciality, contributes to new healthcare solutions, whether they're working in research and development, chemical and pharmaceutical production, distribution, administration or sales. They all share the same commitment, taking into account what Dr. Paul Janssen used to say. Time is precious. It's 5 minutes to midnight. The patients are waiting.